Today I'll be speaking about a clinical case study of a 32-year-old female with hantavirus pulmonary syndrome, valley fever, and a small bowel obstruction. I want to begin this presentation with descriptions of the three primary diagnoses. First one being hantavirus pulmonary syndrome. This infection is acquired when an individual comes in contact with rodent feces, urine, or saliva, and it really should be suspected if any individual resides in a rural area and has possible exposure to rodents. And they also come in with, say if they come in with signs and symptoms of fever, fatigue, muscle aches, chills, nausea, vomiting, abdominal pain, dry cough, and then even some more severe symptoms such as cardiac issues like pulmonary edema or arrhythmia. Severe cases of hantavirus pulmonary syndrome can actually cause acute kidney injury and kidney disease. The second primary diagnosis in this case is valley fever. So valley fever is caused by a fungi that grows just below the soil surface, and then when inhaled can cause infection. Normally, it would be very typical if the soil is being disturbed, such as digging it up and moving it around. Signs and symptoms include fever, headache, cough, fatigue, chest pain, chills, shortness of breath, muscle pain, joint pain, rash that can be found in the upper and lower extremity, or both, honestly. Ascarius is the third diagnosis in this case. It is a large roundworm infection that infects the human intestinal tract. It's typically acquired when the individual comes in contact with water, contaminated water or food. Typically, it's in areas with poor public sanitation or in areas when a person has people have poor personal hygiene. So if an individual who has the infection already, uses the bathroom, doesn't wash their hands, and then prepares food, that can pass along the infection. But I also found that it can come from uncooked pig or chicken liver that have larva infestation. Signs and symptoms can also include dry cough, difficulty breathing, fever, wheezing, slightly bloody sputum, as well as hives. So going into this patient that we have here, she's a 32-year-old female. Upon admission, her weight was 118 pounds, but typically her weight is 134 pounds, and she does complain of a 16-pound weight loss in the last 3 months. She is about 5'7" and has been traveling in the Mexican jungle for about 1 year. She is an archaeologist and has been working in the caves and remote areas, trying to find artifacts. Pertinent medical history include a terminal ilia resection secondary to Crohn's disease. So this patient has Crohn's disease as well, and she is vegan. So she also has a vitamin B12 deficiency due to her vegan diet, which she normally takes supplements for. This patient also has a personal chef who typically makes all of her meals, as well as just to mention as well, she has a vitamin D deficiency due to the fact of her traveling and being in remote areas, in caves, and other dark areas that she's not getting enough sunlight for. So, chief complaint upon admission, she complains of 3 months of abdominal distension, abdominal pain, specifically in the epigastric area. She had poor appetite. Like prior mentioned, she had the 16-pound weight loss and nausea and vomiting. She went to the remote clinic in Mexico, and she was treated for gastritis, and given antacids, but that had no relief for her. About 4 or 5 days ago, this patient started developing headache, cough, diarrhea, fever, night sweats, rash on legs, and general not feeling well, having muscle pain and fatigue. With those increase in symptoms, she decided to come to the United States. And upon admission to the hospital, she deteriorated quite quickly and developed hypotension and pulmonary edema. So with the deterioration, quite drastically upon admission, the hospital staff decided the best thing would be put her on mechanical ventilation and TPN. They then did abdominal imaging and found that there was a mass in the jejunum, a thickening of the terminal ileum, as well as tube-like structures that were found in the small intestine. And with those images, they kind of figured that there was a small bowel obstruction secondary to this roundworm infection that's quite common in the region that she was in. So with the roundworm infection, they decided to do exploratory surgery. And what they found when they opened her up was necrosis that was actually in the proximal jejunum, about 100 centimeters of it. They did find the roundworms that they suspected from the imaging, but they also found a mass in the duodenum and a perforation in the duodenum. So with that being the case, they made the decision to remove the mass to help with the bowel obstruction. They also removed the duodenum and the proximal jejunum, and they created an anastomosis. So nutritional implications in this case, this patient, based on lab values, has most likely developed a kidney infection, not a kidney infection, a kidney disease, which was secondary to the severe hantavirus infection. So this kidney disease really has to be treated, as it can lead to kidney failure. With this patient already having the removal of most of the bowel, it is really important that we don't allow her to get to kidney failure, because that also increased the mortality rate of this patient. With the severe roundworm infection, that can also lead to malabsorption due to the blockage of it, and the nausea and vomiting that I mentioned in the beginning of the presentation. Just having a bowel obstruction alone, even if it isn't the roundworm infection, can actually just cause vomiting, which then can lead to dehydration and decreased food intake. So with this patient, day 4, her bowel function actually recovered, and she was extubated. So the dietitian on staff wanted to switch her from TPN to internal feedings. So they recommended a feeding that is like a liquid diet that was 1.5 calories at 45 cc's per hour for 24 hours. That would be about 1,620 kilocalories. And then protein would be 68 grams, and then also free fluid, because this patient needs to increase hydration, was 816 cc's. Also, to increase hydration, the dietitian recommended 34 cc's of water in 24 hours. Associated medical conditions due to the patient being in bed so long was she was actually diagnosed with DIC, which is a thickening of the blood. She was treated with heparin, which is a medication that can help thin that blood, and she was also diagnosed with a stage 3 pressure ulcer on the coccyx, and that was treated with working with the dietitian on staff to increase her protein. When in 1 month post-op the patient was discharged, she was then scheduled for a bowel transplant, which occurred at another hospital. During that entire time, she was also getting continuous nutritional therapy. So the outcomes in this included she regained 10 pounds, and the patient feels like she's increasing in strength. And the patient really feels well enough after the bowel transplant to resume her normal lifestyle, which includes, traveling throughout the world and doing all of her adventure type activities. So nutritional recommendations, since this patient seems to have developed a kidney disease due to the severity of the hantavirus, I would recommend making sure she has a daily protein intake of 48.8 to 61 grams of protein. This patient is a vegan, so kind of making sure that she has having enough protein, but also not like high levels of protein at each meal. So making sure it's more like a tofu base, which for this patient wouldn't be such a problem. Daily energy intake like 1,800 to 2,400 kilocalories per day, to make sure she's getting enough calories to sustain her throughout the day. She should also be supplementing for vitamin B12 and D due to these deficiencies that she has, which probably should be reassessed yearly by her primary care MD. The B12 is most likely due to the vegan diet, and if she was to stay on that diet continuously, even throughout these recommendations, most likely she would still need to do supplementation. She needs to be careful and decrease her phosphorus intake, sodium intake, and potassium. So those can be probably kind of problematic due to her vegan diet. So she needs to avoid beans for the potassium, the phosphorus issue, nuts, nut butters, oranges, bananas, potatoes, and bran cereals. And she could easily decrease her sodium intake, just decreasing sodium like in her meals, since she is doing more vegan diet. But she really needs to be careful with the potassium because it's so high in fruits and vegetables, and also the phosphorus as well. And that is my recommendations, and this is my presentation for this 23-year-old, I mean 32 this 32-year-old who is presenting with hantavirus, valley fever, and small bowel obstruction. And I would like to thank these references as well. Thank you.